Hi, my name is Peter Orpin. I'm a veterinary surgeon and a director of Myhealthyherd. Over the next 5 minutes I'm going to take you through how Myhealthyherd can be used to help control and protect your herd against Johne's disease. The clinical symptoms of Johne's disease in the latter stages are one of dirty tails and scour, disappointing yields, and marked weight loss in the hindquarters. These cows are rare. Normally what we see in modern well-managed dairy herds is a preclinical case, and in this particular case the cow has lost weight and is showing a reduced milk yield. And many of these cows are actually underdiagnosed and usually called barren, high cell count or due to low yield before the clinical symptoms develop. Indeed, many infected cows may look perfectly normal. Some of these are infectious. In this particular herd, the farmer is in a testing program, and this cow is actually tested positive and is now being marked as a red tag or infected or potentially infectious cow. How does the disease enter your herd? The main risk of disease introduction is through the purchase of carrier or incubating cattle and slurry from other farms. There are a number of other risks. These are all dealt with within the risk assessment tool within the program. How is the disease spread? There are three main routes of spread. The first route is through spread through the blood supply or via the uterus, and a very small proportion of cows may be born infected at birth. However, this is not the most important route. The most important routes are through either milk and colostrum, or even more important, through contamination of the calf and the environment of the udder with the Johne's bacteria. So this is how it happens in real life. This is a communal calving yard. One of the cows on the right is infected. She contaminates the alleyway and the straw and the yard with Johne's bacteria. This in turn contaminates the mother, and the calf then becomes infected. In many herds the infection occurs in the first few days of life, and that then sets the Johne's destiny for that calf for the rest of its life. Pooling of colostrum and using waste milk, these are all reasonably efficient ways of actually spreading infection within dairy herds. This is a graphic of how infection can spread within a herd, and in this particular instance there's one animal that is testing positive and there are 3 incubators coming up behind her. If we can actually identify the risks and put in place a robust control program within this herd, we can stop the spread of infection and move this herd quickly and efficiently to one of disease freedom or low risk. However, in many dairy herds there's not an active plan in place, and as a consequence the disease may be present at quite a high level. Now if we're starting here, we need to use the program to help prevent the spread of infection and disease, and it will take several more years and possibly a lot more money and resource to actually eradicate infection. Within the program we also provide guidance on testing and what's the most effective, what's the most reliable. And ultimately what we're trying to do is to help you choose the most cost beneficial method of control. There are 7 or 8 methods of actual control, and what we're aiming to try and do is to find the one that suits your farming system. So if you're starting here with a 20% infection rate, if we do nothing it will track up inexorably to a much higher level over a number of years. However, if we can choose an effective and robust control program, within 5 years we can make this disease a minor nuisance. Why bother? Well, all the work has shown that herds that are free of the disease will have optimal margins. In this particular slide provided by Sorrell Nielsen, we can see that those healthy animals are significantly better off than those that are heavily infected. And this gap can equate to about 1 pence per litre in UK conditions. How does Myhealthyherd work? It's a web-based system. You can access it, your vet can access it, and indeed if you're within a regional control program they can access it as well. We can assess the risk of entry of diseases through cattle, people and objects. We can specifically look at the risks of Johne's introduction and whether it's going to spread. We can also look at the future prevalence and whether the risks are going to make the disease spread within the herd. And then most importantly down here, you can work with your veterinary advisor to actually put in place a robust control program, a robust testing program and a protection plan. Lab results can be stored on the program, and indeed there is direct links with some of the labs as well. So this is Myhealthyherd. It will provide you secure access via the web, and it's going to allow you to really fully understand the risks of how Yonis could impact on your herd. It will help predict the future incidents within your herd, and it's going to provide you with real good solid guidance on testing, control and protection. You're going to be able to link with regional and national programs, and ultimately if you use this tool in conjunction with a well-trained vet, you will be able to create an effective control and protection plan for your herd and rid your herd of this infection. Thank you.